WDATV River Market Studio in downtown Little Rock. This is Channel 7 Good Afternoon Arkansas with Alicia Dover and Barry Brandt.
Well, I'm back with Dr. Charles Chamblee. We're talking about stress from caregivers, and as we live longer, a lot more people are taking care of older people, but I guess that's not exclusively what you're talking about.
Yeah, and we mentioned that just briefly earlier. It's all ages. If you've got somebody who maybe has a disability, maybe somebody who had an injury and they are laid up for a period of time, or there are all kinds of situations that can take place in. And that's a stressful kind of thing, having to take care of somebody.
Right, you're trying to juggle a lot of what you have to do, and then what you need to do too.
Yeah, and if you have a job or if you have other responsibilities that you're trying to take care of while taking care of somebody else, the stress just mounts and mounts and mounts. And that's a lot of time why we see some caregiver injury take place. Why? And what I mean by that is getting upset with somebody, getting frustrated. Maybe you hear about elder abuse, things like that. That often comes because of the stress that's involved in caring for somebody.
You're just stretched a little too thin.
Absolutely. Just too much to do and too little energy, too little time to do it all.
When somebody, and I'm sure you see people that are experiencing this, when they come to you, what's kind of the first thing what do they come to you and say? How does it manifest itself, in their mind anyway?
Well, I had somebody who called me just this past week with the same exact thing, and they mentioned that they are so short with one that they have loved for so long, and they don't have the patience that they know they need to have. And add that to the fact that they're not getting enough rest, they're not taking care of themselves, and so the ability to take care of somebody else, that is compromised.
It seems like the easy fix, that's horrible to hear, but the easy fix would be, okay, you've got to carve out some time for yourself, you've got to have some help, maybe even at periodic times.
Yeah, that would be the easiest thing to do, but there are so many limiting factors to that. Having family in the area that can help. Do you have the finances to be able to assist and to have professional help come in? So there are so many things that prevent that from being such an easy answer.
So what are some things that you can do then?
Well, as we often try to do, I want to make it something that's memorable for somebody, somebody they can take away from. So we've taken the word care and try to give people some practical things about that. First thing we suggest you do is create a team. Try to find some folks who can help you. If you can't afford professional help and maybe you don't have family in the area, there are oftentimes places that will offer volunteers. Alzheimer's Organization, Cancer Society, American Heart Association, all of them may have resources that you can tap into. Maybe your local church, but create a team to be able to assist you in that. Secondly, don't hesitate to ask for help. And that's hard to do. Many people don't want to humble themselves or don't want to think that they can't do it by themselves, and so they're hesitant to ask for help, or they don't want to impose upon somebody. And so, but you've got to be able and willing to do that. Third thing is, when you do have the time, like you mentioned, take some rest. Rest, rest, rest. If you're not able to take care of yourself, you certainly can't take care of anybody else. And so you've got to make sure you do that. And then finally, the last thing is have some realistic expectations. There are going to be challenges that come up. And so you've got to expect that there are going to be challenges, and try to think through how you're going to be able to handle those. What are you going to do if an emergency arises? What are you going to do when you get sick? Expect some challenges to take place, and have some thoughts in place about how to handle it.
Well, good things to think about there. We're all probably going to go through it at some point.
One time or another, we probably are.
All right. If you want to get in touch with Dr. Chamblee by email, it's crchamblee@practice-plus.com, and there's the phone number on the screen, 501-487-6010. Thanks so much. Always good topics there.
Thank you.